Then I'm going to get my patient into side lying. So if you'd like to lie on your right hand side, facing away from me. Perfect. And this is the first of our hip dominant eccentrics. So if you bring your knees up for me. Hip dominant eccentrics are quite difficult to obtain because we know that it's really easy to get an eccentric at the knee. We've got loads of range of movement to go into, a good 140 degrees of knee flexion. So it's really easy to load that. It's really difficult to load the proximal end because we've only got maybe 10 degrees of extension, if that, in some of our patients. They're going to be really restricted. So we have to work really hard to get that. So one way we can get it is by taking the patient's thigh, grasping just above the knee. And again, I'm going to take you into this hip extension moment. I'm blocking behind to stop them kind of cheating, going to like a lumbar extension. And you're going to provide some resistance, but let me win. Okay, and off we go. Good, and relax. And then back again. Nice, so we're providing that manual eccentric at the hip. And again, because of the position we're in, we've got the knee in flexion. That rectus femoris is going to be at real length. We can really isolate the proximal end. And again, it might look really simple, but it's a really, really effective way of getting an eccentric around the hip. And then the last one, if you go back onto your back, but slide down off the end for me. So we're going to get our patient into essentially like a Thomas test position. So if you come to the end of the bed, is right by your hips. So keep coming down for me. Perfect, and then lie back. We want you to lift your knees up for me to 90 degrees. And I'd like you to squeeze that ball. Perfect. And then you're going to lower your legs down to the ground. Perfect. Keep those knees bent to 90 and back up. Good, and if you just perform 5 reps of that for me. So we've got a slightly weighted ball. They're having to decelerate again into extension. We're clearing the hips by the end of the bed to give them a bit more range. We're getting, again, thinking about complementary musculature that we'll come on to slightly later. We've got an adductor load. We've got a bit of abdominal load as well. What's the lumbar spine doing? I'll just take that away for you. Perfect. So that's a really, really good exercise. Again, in the early phase, it's bilateral, but we're trying to get everything in the area of recruiting, thinking about technique, and we can really progress that. We can increase the weight of the ball. Again, we can add an overload resistance to it, so they have to really decelerate in those phases. But they're just 3 really good eccentrics. All we need is the bed, and we can get the exact load that we require just by thinking about positioning, speeds, and how we're looking to achieve it.